All right. Hello, everyone, and welcome to our final CPH review session for this summer. My name's Ashley Mueller, and once again, I will be monitoring the chat and the Q&A throughout the presentation. So if you have any questions, please feel free to put it in the Q&A. We'll also be monitoring the chat, but if you put it in the Q&A, then we'll definitely see it at the end, and it doesn't get lost in the chat. The chat is open so that you can interact with your fellow attendees, and please feel free to put where you're from and respond to anything that the presenters are talking about. So today's session is Policy and Advocacy, presented by Lillian Egbe. Dr. Egbe is your friendly community health educator and is a compassionate public health educator, advocate, community organizer. She works on health issues that are disproportionately affect women and children, including AIDS and HIV, intimate partner violence, healthy housing, and human trafficking, and that are others that are impacted by social determinants of health and complex systems. She is an expert at creating shared vision and building sustaining collaborative partnerships for improved health outcomes. As a member of the Maryland Public Health Association, she currently co-chairs their communications committee and their Your Public Health Professional and You program. She has served on the Maryland Network Against Domestic Violence Board from 2017 to 2019, Port Watch Montgomery from 2015 to 2023, Howard County Coalition to Prevent Intimate Partner Violence since 2014, and She Rises International Inc. since 2020. She is currently serving a third term on the Family Violence Council after being appointed by Governor Larry Hogan in 2015. She co-chaired the Healthy Teen Dating Workshop and Abuser Intervention Program Workshop, and she currently chairs the Survivor Advocacy Council Work Group. At Polaris, a leading anti-traffic organization, Dr. Egbe wrote the Human Trafficking at Home, the Labor, Trafficking, and Domestic Workers Report, and coordinated an upstream sex trafficking prevention initiative implemented by 9 cities across the United States. Dr. Egbe was one of NBPHE's 2022 Leadership Award honoree. In 2023, she received the citation recognition for outstanding community service from Governor Westmore. She also received the NBPHE President's Award for Significant Impact on Public Health in Maryland. Dr. Egbe is an adjunct faculty at Bowie State University, a historical Black university, where she teaches graduate classes in domestic violence crisis counseling. She earned her doctorate of public health degree from the University of North Texas Health Science Center and her master's in public health in community health education from the City University of New York, Hunter College. She earned her bachelor's degree in economics from the University of Lagos, Nigeria, and she is certified in public health and a certified in public health education specialist. So with that, I would like to turn it over to Dr. Egbe for today's presentation.
Hello, everyone, and thank you for joining me. And summer's coming to an end. It was nice to hear that citation, Ashley. As you were talking, I was like, oh, wait a minute. Has school started? Do I have a class tomorrow? Yes. So as adjunct faculty, my classes start tomorrow. I put in a link to my LinkedIn profile for anybody who wants to connect with me. I was also thinking that at NBPHE, Maryland Public Health Association, Your Public Health Professional and You is a program where we talk to public health practitioners about how they got into the profession and how their work is going to impact members of the public that they might not get to meet. So if you are interested in participating, please feel free to reach out to me. And now I'm going to share my technology. I think we'll have a wing of it by now, but no, it's still an issue. Great.
Perfect.
So today we're talking about policy and advocacy, and as you will find out, or some of you may know already, the work that we do is very much integrated with policy and advocacy. This is me out being an advocate, and you always don't have to have this stern look, but I thought it was important to have the look to go with what we were advocating for at that time. We're advocating for a safe exchange center for parents in domestic violence situations that have children in common with their abusive partner. And as you can see, sometimes we use pins for advocacy work. One of those pins says Save Kids because we wanted safe space for kids. And that page I'm carrying up is about somebody who lost her life while she was trying to exchange with the other parent. So it's a lot of important work that we do in this level in the community, and you have to be out and about. I sit on council, I work in subcommittees, I sit on boards, I give presentations. It's part of the lay of the land of what we are doing with public health advocacy. For today, we are going to review the 10 essential public health services, look at the CPH exam domains, and then we will now focus in on policy development, which is the area of focus of this training. We look at the policy making process, what are the factors that influence it, and what are the challenges, and we will review some practice questions so you can get prepared for the exam. Like Ashley said, she's going to be checking the chat. So please let your questions flow. Questions, comment, concerns, and we will address all of those. These are the 10 essential public health services. A lot of you are very familiar with these in three large buckets: assessment, policy development, and assurance. And we've over recent times centered it on equity. And you'll begin to understand why equity is a policy issue and how that has come into this. Until recently, I used to take one aspirin every day in the morning because, research says, oh, it's supposed to help with your health. I've come to find out very recently, though, that the science behind that was really based on research that were done with men and with white men in particular. And so you have to wonder, how does that work for me, being that I'm female and I'm Black? And that's one of the reasons why assessment, policy development, and assurance work in the field of public health has increasingly become centered on equity. We have to make sure that we are addressing things in an equitable manner. There was an audio on that. You probably may not hear it because I didn't set my audio, but these are the 10 domains for the CPH exam. And what they've advised you to do is identify the one that is familiar with you, start there with the easy ones, and you go to the one that is not so familiar. Today, we are focusing on policy and advocacy. And focusing on policy and advocacy, I'm going to get a sense in the room about, what do people understand to be health policy? So for that, we are going to go to Mentimeter. If you just go on your internet and go to Mentimeter, and I will share the code for us to look at it. So I'm going to share my screen with that code.
And as soon as you have that up, I will put this
Okay.
The code. Where's the code?
1 second while it loads. So it's 19318942. 19318942. And the question is, what is health policy? What's your understanding of health policy? Go to menti.com, 19318942, and let's get some feedback from you about what is health policy.
Thank you, Michelle, for putting that in there for everyone.
Plan, that's good. Framework, control, laws, law, regulations. Improve health, reform strategies. Administration. I'll give it another minute or two. Thank you very much. All this is very good. Ed has done us in here, so we don't have any two responses that are quite the same because we have law and laws, we have regulation and regulations. But really, these are the sort of things that we are talking about. Laws and regulations, and a lot of times they allow us to do all of these other things, such as improve health, provide opportunities for stakeholder engagement. We get to it because there's evidence base sometimes for us to advocate for them. It helps formulate our strategies. And I just wanted to get a sense of where we are with that, and we will go back to our presentation. Share your screen. So we've looked at all of those presentations. When we talk about policy, according to the Centers of Disease Control and Prevention, we're talking about a law, we saw that, regulations, we saw that, procedure, we saw that, administrative action, incentives, or voluntary practice of government or other institutions. So a lot of you are working in offices where you have some sort of health policy. If you are sick, do not come to work, right? And so these are policies. It can be for government and it can be other institutions, either in our offices or whatever in our community. Policies take two main focus areas, especially when we're dealing in a government setting. So we're looking at laws, which are a system of rules that are created for the protection of promotion of community health. Those are usually done by the legislative branch of the government, either at the state level or at the federal level. And then we have the regulations, which are the set of rules that describe the implementation of the legislation. A couple of years ago, the organization with which I did at Advocacy, where you saw that picture, Cutwatch Montgomery County, we wanted to do some work around based on the findings of observing court proceedings. And we found out that judges were not telling offenders that they couldn't own a gun. Only one judge told an offender out of, I think, about 250 cases that were studied or so. And so the first time we tried to pass the law, it didn't pass because there's more to a law than just the law. There's the regulation and who's going to enforce it. And we had gone to try to advocate this by ourselves, but it turned out that beyond getting the judges to say you don't own a gun, there has to be regulations in place about who collects the gun, where do they turn the gun to, and what's all of that process. So that's the second end of it. And all of these things work together. This next diagram is one that is well used in the policy space, was put out by Longest in 2002. And it really tells us about these three phases of policy formulation. The first phase is the formulation phase itself. You set the agenda about what exactly is this problem in this community? What are the possible solutions? What can we do about it? Very critical though, in order to move forward, you have to have a window of opportunity where certain things align, and we will look at that as we go further along. When those things align, you have that window of opportunity, then you pass the law. After you pass the law, becomes the second phase where you have to actually implement it. So who's going to be involved? How much is it going to cost? What's the translation of all of it? And then after you've done it, there's a third phase where you begin to say, did this policy work? We want everybody to wear seatbelts. Are they wearing seatbelts? Do we have to have different times? What are the speed limits? People are drinking, they can't drink and drive. What's working? What do we need to change? If you notice for drinking and driving, for instance, have we lowered the alcohol level? Cigarette smoking used to be at a certain age. After a certain time, we see that, what we're doing is working, but it will work further if we raise the age. So now you can no longer buy a cigarette at the age of 18. You have to be 21. I believe that's the correct age. But those sort of things, you look at the policies in place. Is it working? Can you work better? Isn't it working? What do you need to do? All of those things are factors in whether we're going to modify the policy that is in place. So the policy making process actually starts with agenda setting. You have to identify the problem. What is going on in our community? What do we need to do differently? And who is involved in doing it? I always like to consider the example of gun and gun violence, for instance. Gun violence that we see in public health, we sort of see it on two fronts. We see it sometimes in community violence, where gang violence and it's going on and people are killing, people that they have beef with. We also see gun violence when we talk about mass shootings. Because of those scenarios, because those two scenarios are different, the policy solutions are going to be different. Because it's not so, there's an organization called Cure for Violence, and they are out in the community, building relationship, identifying leaders in the community, and having them be the examples of how to resolve issues without resorting to gun violence. That solution is not going to work if we're thinking about mass shootings, right? Because the population in both cases are different. If you look at the history of mass shooters, most of this is predominantly white male. And if you look at community gun violence, predominantly minorities or Black men. So you have to identify what is the policy situation in each case, and that's what you're going to work on. And then when you identify those policy situations, if there is a policy solution for that situation, you begin to say, okay, propose a bill. We need to pass a bill into law. And you work with the House and the Senate, either at the state level or at the federal level. And when that bill is passed, it's signed by the governor at the state or by the president at the federal level. What's this process? As you go on, you begin to say, okay, fine, we have signed this policy into law. We have to implement it now. So when I spoke earlier about that situation in Maryland, the first year it didn't pass because we didn't have the police at the table. And it's like you can't just tell judges to tell people that, they can't own gun. What is the process in place? And after that, two other policies have passed since, because then we now passed the policy. We got the police involved. They now said, okay, we can collect the guns. But now we have a policy that's actually tracking the guns. Yes, the police involved. What county is doing it better than another county? Can we learn from the people that are doing it better? Can we, say if everybody's doing it poorly, then maybe something is wrong. This is where the evaluation comes in. So the goal of having that policy is to reduce mortality of domestic violence survivors from abusers who have been convicted. So if we have this policy in place and people are still getting killed by guns, then that means that either the judges are not telling people, the judges are telling people, the police are not collecting it, the police are collecting it, they're not storing it well. There's so many places in which we can evaluate whether this policy is working to address the problem that we have identified. And when we're able to do that evaluation, then we say, okay, this policy is working, we should continue it. This policy is not working, maybe we should modify it. Maybe in addition to having the judges tell the police to turn it in and the police to take the guns from the victim, maybe there's something else that we need to do. Or maybe it's not even working at all, right? So you get to that position where you do the evaluation and you get to the place where you say, okay, we need to repeal this policy because it's actually not meeting the objectives for which we set it. So that is the policy process. But how do you identify public health problem. You have to look at it and say, what is going on? What is your goal for trying to solve this problem? If you take the gun situation again, whose interest are you representing? I remember in my first public policy class, we were told about the big five that public health has an issue with. That's the automobile industries because of these huge cars that are polluting the atmosphere and for which fatality rates are usually higher when a huge car hits another small car that so they hit the person directly. So there was the automobile industry, there was a concern for public health. The pharmaceutical industry was a concern for public health because they have the patent, but can we have generic drugs that people can afford? The gun industry, like we talked about, the alcohol industry, where they tell you that, yeah, alcohol is not a problem, but you are marketing alcohol in certain populations more than others, and then the tobacco industry. Those are five people that if you try to address those issues, they have lobbyists that can come against you. But you have to really look at when you want to deal with a problem in your community, find out, look at the problem, who is impacted, that directly or indirectly. What are the adverse health and social outcomes? Does disparity exist? What do we need to do? One situation that caught people's attention not too long ago was the infant mortality rate in the United States. I mean, it almost, each time I see this slide and I see this information, it's always something that sort of really grieves me on the inside. Why are we talking about rising infant mortality rates in the United States of America? Why is this a thing? So you have to say, okay, since this is a thing and people have said it, what do we need to do? What population is being affected the most? Let's talk with the experts. Let's talk about the people who are doing the research. What population are you finding it? Is this a problem of insurance? Is this a problem of access to prenatal care? Is this a problem of materials not being available in language that people can understand? Have people tried to solve this problem before? What did they do? What worked? What didn't work? We have to really look at everything and bring all of those things together to say, help us decide what solutions are going to be in place. Beyond talking with people, beyond looking at the literature, beyond all the academic side, there's also the side of the people. Are we in an elections cycle? You have to consider local laws, state laws, and federal laws. Recently, racism was formally identified as a public health issue. We've always thought about racism as an issue, but not really. It really crystallized as a public health issue after the George Floyd situation. And at that time, they tried to pass the George Floyd Justice in Police Act in 2020 because there was like the political climate, everybody was saying something was going on. It passed in the House, it didn't pass in the Senate, so it's not a law yet. So it has to be the visibility of an issue. What's the public position on it? A couple of months ago, a lot of us that work with populations that have to do with housing and homelessness were really beyond ourselves when the Supreme Court passed the grant pass that declared that people can be arrested for sleeping out in the open. And you have to say, how did we get there? So this is now a policy issue that people working in the policy space have to be thinking, how do we address it? People are homeless and are out in the streets, they are unhoused. Now, in order for people to get accommodation, if they have a criminal record, it reduces the chance that they can get accommodation. So you can imagine somebody is already unhoused. You're now arresting the person. They now have a criminal record. It reduces the likelihood that they will eventually get housed in the future. And we didn't think that that was the solution. But was there enough window of opportunity for us to push forward to the next level? This is when we talk about what is the public position on the problem. How aggrieved was the general public that, homelessness has become criminalized with a Supreme Court ruling in the United States. What do we know about it? In order to move forward in this sort of situations and other situations, there's something that we really talk about is the window of opportunity. The window of opportunity in public health stems from three factors that have to sort of be in place. There must be support among the voting public and policymakers that the problem should be resolved. There must be support for the proposed policy design. And then the political relationships have to be receptive to change. So the issue I talked about, criminalizing homelessness, for instance, where are people on the spectrum? Where are the parties on the spectrum? Where are people on the spectrum? We seem to be able to go forward in situations where there is that window of opportunity. And there's a poll question, and I'm going to come up. Actually, this is the time for this poll question about the Affordable Care Act.
Okay.
Are you ready for that now? So there's a poll question coming up for us about the Patient Protection Affordable Care Act called Obamacare, which was passed in 2010. Now, what do you think was the answer? Ashley, can I let you share that?
Yeah, can you share the screen? I don't have that one as a poll.
Oh, you don't have that one as a poll.
Yeah.
Okay, so people can give me their answers in, do you think it's A, B, C, or D?
Yeah, and you can all put that in the chat.
Mm-hmm. I'm not seeing the chat,
I
so
see some B, B, D, D. Looks like we're getting a mix of B or D.
mm-hmm. Yes. So it's B. The majority of Congress supported the proposed policy solution. It's not A because if the Republicans had their way, it wouldn't have passed. And we know that not only because of what happened at the time, but we know that tremendous efforts are being made to repeal it. You know, the political climate between the Republicans and Democrats wasn't favorable. They were at each other's throats as they are, and it wasn't all of the above. But this is the window of opportunity. They just happened at that time to have Democrats happened to have a majority that and were in majority and they supported it and it was able to pass. Now, even like I said, efforts are being made to try to repeal it. So it's not something that will pass. But this is what we talk about, a window of opportunity. Who is in power? We've always talked for years about the insurance, the number of uninsured, and compared the rate of uninsured in the United States and all the other developing country, Norway, Canada, and other places who didn't have issues with insurance. And so even though that was a problem for a very long time, it was finally able to pass as a legislation in 2010 just because of the window of opportunity at that time. So how do we develop a legislation? It's a long process that goes through all of these steps. Somebody in the community says this is a problem. Any of you can identify a problem, either based on the work that you're doing in your own organization, or you belong to a coalition or a collective, and some of your partners identify that this is a problem that needs to be addressed. And what you will do is work together to find that problem, go and find a sponsor or two sponsors. The more sponsors, the more better. But they have to be strategic in what committees are they serving it. And then you put it in. You might have to do a lot of negotiation, put this in, bring that out, put this in, bring that out. And you will take it to one house. They will present it in one house, passes in one house, take it into the other house. They might say, we'll pass it with modification, accept it as it is, take this out. What does this mean? What doesn't this mean? And everybody goes and votes in it. It passes, can go back and pass the second house. And when it passes both houses and is voted upon, then we have a bill becomes a law. So in terms of government, we have the three arms of government, as everybody knows. There's the federal level, and they pass laws at the federal level, and then there's the state, and then there's the local level, and everybody has some authority in terms of passing public health laws. So when these laws are passed at the federal level, they can be they can override veto two-thirds of the bill in both chambers if the president signs it into law. And then there's the judiciary, which is the arbitrator, sort of like, they can challenge this. So the law I was telling you, criminalizing homelessness, for instance, was something that went to the Supreme Court. And as we're going to talk a little bit about in future, Roe versus Wade was something that went all that way there. And we begin to have these conversations about, should we do this or shouldn't we do this? So the right to health, this might be another one then that you don't have. Do you have this, Ashley?
No, I'm sorry. I only had the
Okay.
questions at the end.
The right to health, what does the right to health means when you think about as a public health practitioner, when you say the right to health, what do you think this means? And you can put your answers in the chat.
So we have A, C, A.
Yes, it's definitely not D. So definitely, definitely not D. Not everybody must not have and then it's not B because they cannot establish this if they don't have resources. But it's A. Everybody has a right. Everybody has a right to be healthy. Now, are they going to be healthy? That depends. But the right to health means everybody has a right to be healthy. So we have to put things in place. And usually in public health, we use the iron triangle to address the issue of everybody has a right to be healthy. Everybody has a right to have access to health. Everybody has a right to have quality health. And everybody has a right to be able to afford healthcare. So the iron triangle talks about these three things, and we look at them when we are concerned about healthcare for all. Now, in terms of access to healthcare, we really want to work on increasing it. So we look at policies and say, what policies, and this is what Obamacare was um, trying to address, how do we increase access to health so that people can receive needed health and resources? Conversely, we want to be able to reduce barriers to access. So we want to make sure that people are not traveling very far to access healthcare. And if people have to travel far, do they have access to transportation? Are there healthcare facilities that people can? So how do we reduce issues of transportation for access to health? Can they afford it? So what are the financial resources that people have? And then personal conflicts. Are there services that people can afford that operate at all times because people work schedule? So can people take time off from work? What are we working in collaboration with employers? Do people have sick hours? Is there policies? So you see that's why organizations have policies that allow you to have sick time off because you need to be able to access healthcare services. Some facilities operate during the weekend, some facilities operate after hours. What are we working to make sure that people can access all of these services? When we talk about health, we're also talking about the quality of health. According to the World Health Organization, is the extent to which healthcare services provided to individuals and patient population improve desired health outcomes. So in order to achieve this, healthcare must be safe, must be effective, timely, efficient, equitable, and people-centered. Do you have the translators? Do you have, are they in the locations where people can readily access? Do we have healthcare providers that people can connect with? This is all of what we're looking at when we're looking at the iron triangle. We're looking at cost. Is this affordable? A lot of people say healthcare is so expensive and can result in major medical debt. I'm not going to take a poll on, how many people have. Well, okay, this is probably the population. You might have healthcare insurance through your job since you're here, but a lot of other people, even with healthcare insurance, actually have significant medical debt because of trying to access healthcare. So we look at what is healthcare policy and all. This is kind of policies that we want to look, like we said, want to make sure that people have facilities near where they are and people have transportation. It's interesting that we're talking about healthcare for all. We're talking about housing, which was why I said earlier on that there was a lot of outcry amongst people working in the public health sector about that law criminalizing home, being unhoused, because people who are unhoused um, cannot get housing if they have a criminal record. So how are you arresting people? It has implications for whether they can go to work, whether people are working has implication of whether they can afford nutritional food and pay attention to water and sanitation. So all of these are factors that are really very important for policy and advocacy in the public health arena. But in order for us to do all of this advocacy, we can't just say, just like the placard I carried and about saying this woman died, it wasn't just about one woman dying while she tried to exchange her child. We have to do this whole using the scientific evidence. So we have to collect information and be able to say, this is not something that is a fluke. This is something that happens systematically and happens consistently. So, in order for us to advocate, in order for us to get community members to come together and say, okay, we can work on you, we have to be able to show that this is something that is impacting our community. So, we collect the data, we analyze the data, and say that this is not a fluke, this is not happenstance, this is something that is happening by design. We communicate it to our partners, we come together, and we say, based on all of this information, we can go and find champions in our community. Somebody who lost their baby because they didn't have prenatal care, information wasn't available in their language, all of those things. We put all of those information together, and it becomes the basis for which we can begin the journey of advocacy. All of these are sources for data, but all of our data does not always have to come from large institutions like the CDC or the County Health Rankings and Roadmap by the Robert Wood Johnson Foundation. But these are, if you want to make changes at the state level, at the national level, these are the sort of policies, this sort of source of data that we need. But when we're working with community partners, we can get data from organizations within our community. So earlier on in introduction, Ashley was mentioning, this is a report I put out when I was working at Polaris, Human Trafficking at Home, the Labor Trafficking of Domestic Workers. This was not CDC data or Robert Wood Johnson data. This was the data from Polaris, which operates the National Human Trafficking Hotline. And then the National Domestic Worker Alliance as well. They conducted a survey and used data from the hotline and the survey to put out the report. Now, this report had key recommendations that have implications for policy. So one, outrightly calling for passing a federal domestic worker bill of rights. At the time I put out this report, I believe there were like I think nine states and one city that had a domestic worker bill of rights. We can't wait for every state to pass one. And so, because domestic workers are in every state, and this was why we're calling for a federal domestic worker bill of rights, because the absence of this domestic worker bill of rights was putting people at risk for trafficking. So people working in the labor force can use this report to advocate for this domestic worker bill of rights. The report also called for to end the tied visa policy. Domestic workers were coming in on a policy that tied their visas to their employers. They knew it, their employers knew it, and it became a source for exploitation and trafficking. And we were saying that the focus should be on the fact that we don't want them to be a burden on society or on the government. We understand that. Let it be that they must be required to work, but do not tie their visa to only the original employer. Now, people working in the immigration space can use this to advocate for the visa policy change. then, and this is what we're talking about, evaluating a visa and seeing what is working. So I don't know the history of why the tight visa policy was necessary and it may have worked at one point in time. But now we are seeing that the tight visa policy is actually being used to keep people in exploitative situation and sometimes to even traffic them. So you have to go and review that policy. And this report was able to call for ending, showing from the data we got from the National Human Trafficking Hotline to say you need to end this policy. It's not working. This report also called for a complementary Know Your Responsibility brochure. The Department of State is very big on the Know Your Rights pamphlet that they give to workers who come into the country. The truth, though, is that you're giving a Know Your Right pamphlet to people who are in a power imbalance situation. How do they enforce their rights even if they know it? And so the report calls for a complementary Know Your Responsibility brochure that should go to employers who are in a position of power to do something, to hold them accountable, instead of putting the responsibility of not being exploited on the people on the lower end of the power by giving them Know Your Rights pamphlet. And this is calling for a policy issue. Again, it becomes something that we use to advocate for changes in policy in our communities. So when we're doing all of this, we work in collaboration with partners. We come together as partners, and that report that I shared with you was Polaris, the National Domestic Worker Human Rights, the Human Trafficking Legal Center, a collection of community stakeholders come together and say, let us look at this. What does it tell us? You have the various phases, you come together, you collect the data, you analyze the data, you identify what are the key priorities you want to address based on this information, and then you go to the next level. In terms of the next level of what you do, you say, based on this, we want to do advocacy around this, we want to lobby, or we want to fight for earmarks around this. So when we talk about advocacy, we're really talking about work that can be done both at the local level, at the state, and at the federal level. And really ordinary citizens. Ordinary citizens, though, need to work together with people who are providing them the information. So we have this, you go to your churches, you go to your mosque, you go to your religious centers, you go to your community centers, you go to your schools, and you tell people, this is the information that we have. This is what the data shows. Write letters to your elected officials, email them, attend meetings, testify at hearings, give oral presentations, give written presentations. So recently, DC passed its own domestic worker bill of rights, and I testified at that hearing based on my report that this is what we know about the absence of a bill of rights. It makes people susceptible. So you have those oral presentations, you go before the Senate, before the House, testify, or go around and galvanize support in the communities for this information. Now, lobbying is another part on policy where you actually communicate with your policymakers and your staff. So you may have been part of a team where you go together. They have Hill days. A lot of organizations have Hill days or have Capitol days where you go and meet your elected officials and divide yourselves into teams, and then you go. You don't have to meet your elected official themselves. Sometimes they really depend, most of the time, if not all the time, they depend on information coming from their staff in the office. So that's fine. You can go there and meet with their staff, but you're really telling them what needs to be done. And in some cases, we have registered lobbyists that are registered to do this lobby and advocacy, and they go out and say, we want you to vote for this bill, we want you to vote against this bill, and we want something to happen. Earmarks is an opportunity to get funding for special projects, and you begin to work with your elected officials and say, okay, fine, we have passed this bill, or we want this bill to pass, but they're going to need money to train police officers to do A. We're going to need more money for researchers to help us identify the link between A and B. And so that's something that you do in advocacy and going out in the community, bringing members together. when we look at bills, a lot of times these are things that are very critical, especially if you're advocating at the federal level. Everybody, yes, but particularly for federal level, they want to see that you've done the cost analysis. How much is this going to cost? What is the effect? Where's the money going to come from? Who is using the money? What is the benefit for us? If we spend all of this money now and say, okay, fine, we want law enforcement officers to now go and be collecting guns, is there a risk for life? How do we protect them? How are they trained to deal with people who may be high risk offenders, and all of those logistics have implications for whether the bill is going to pass or whether the bill is not going to pass. When the bill passes in this level, it can pass as a law, can pass as a regulation, it can pass as an executive order, and it can be something that is going to be decided by the courts. And so an example is Roe versus Wade, and we talked about the window of opportunity. If you remember, Roe versus Wade passed in, I think, 1973. It was the absolute perfect opportunity for it to pass at that time. And but it was overturned. Again, we look at window of opportunity. A lot of us know that there have been efforts to overturn Roe versus Wade all these years. The window of opportunity, though, didn't come until the composition of the Supreme Court changed. And so at that time, Roe versus Wade was repealed. So it depends on how we're analyzing the political situation where people are. America withdrawing from the Paris Agreement, they signed it at one point in time. What was the policy at that time? Abortions law across the country, some states are in one place, some states are in another place. What is the political situation? What is the will of the people? All of these things have implications for whether laws are passed or not. Passing the laws are not the final, it's not the final thing about policy. Again, like we said, we have to go and evaluate after the policy has been passed. Is it working? Is it working as intended? Are there unintended consequences? Is it working better for one population than another? Who is this policy working for? So when we think about policy and how they're working, what we want to look at the monies that we've invested in putting into it, the people that are benefiting from this policy. And then what is the outcome? If we say that there is gun violence, and then we say, let's put some money into identifying leaders in communities, and so that we can work with them to be mentors. Where are they going to find the people that they are mentoring? How structured is that process? And then can we see the change? Is there a decrease in gun violence in that community after we implement that program? Does gun violence remain the same? Does gun violence just shift from one location to the other? Is that our goal? Is our goal to shift the violence from one location to the other, or to eliminate it in the community as a whole? So all of those are factors in when we're thinking about, what is this policy that we have passed and how is it benefiting people? I spoke earlier on about the impact of the Affordable Care Act. See how the high rate of uninsured among not elderly population. And after the Affordable Care Act passed in 2010, we see that the numbers started to go down. And when you look at it, some states have adopted it, some states have not adopted it, efforts to repeal it, and then you have to say, okay, why are people not adopting it? What do we need to do in terms of education, in terms of taking this data to show that insurance, what's the return of on the investment of, this is what we're talking about, cost analysis and cost benefits utility. What's the return on the investment? What's the benefit when we are making all of these decisions? So the policy options that we have is we look at all of these things and we look at models. Some of this came up in what we're saying, what was health policy, and look at the theories and say, okay, fine, who is going to benefit from it? Are there intended and unintended consequences? if we put we say there's a food desert somewhere, and we decide that, okay, fine, we're going to support people to have a fresh food farm somewhere, but is it easily accessible by transportation? Are we creating plans in places where people don't have transportation to go to? What are we doing? Basically, we want to always look at before and after. What was going on before we did this policy, and what's the situation after this policy? Where will people be with or without this policy? If we do not have this policy, do we have higher rates of obesity in our communities? Do we have lower rates of obesity when we put the policy in place? And then we also want to look at actual versus plan. So we think that if we put this policy in place, this is what is going to happen. What actually happens though when we do put the policy in place? So we have to take all of these things in consideration as we're evaluating the policy to determine whether we want to keep it, whether we want to change it, whether we want to modify it. And these are some of our government institutions that pay close attention to policy, especially at the federal level, to make sure that we are using monies as is for the design project and we are evaluating them. In terms of ensuring consistency, we have to have plans in place. We have to have procedures, structures, and programs so that what is happening, if we want to pass a federal domestic worker bill of rights, for instance, it's a standard law that's going to be the same across the country. Some states might have some opportunity to modify it, to have their own version like Medicaid and the food stamp, McKinney Vento, they have modifications in states depending on where everybody is at. So we put all of these policies in place, and you can't put a policy in place without funding. So we have all of these committees at the Senate, and this is where you are looking for your bill sponsors, where you're looking for leaders in the community who's going to champion the change that you're advocating about. Do you have somebody sitting in a major committee that can help advance the policy that you're looking at? So when we want to implement these policies, either the federal, state, or local level, we find our stakeholders, we make sure that we're looking at them, identify who's going to do what. You might find out that you need to work with an academic institution for your researchers, or some data. Polaris is not an academic institution, but it was manning the National Human Trafficking Hotline. So you can say, okay, fine, you bring in the data. The National Domestic Worker Alliance has a large connection to domestic workers. So you can say they can collect data from the people to say, what does it do to you when you don't have monies or when you have your hours changed without a corresponding change in your payment? So find out all of these partners, we bring them together and we say it's time to do a policy change. Now, in the United States, we have legislative seasons, and that is when we work on policies. A lot of states, some have 3 months, 6 months. In Maryland, for instance, our own sessions run from January to April. In California, their session run until August. So they're going to be wrapping up in a few days. But our session in Maryland has already ended. And some of the organizations that work in Maryland here, the Maryland Legislative Agenda for Women, and you can see these are some of the bills these are practically all the bills that they supported in this legislative session. A couple of them passed, but you can see not passed down there. 2 of them didn't pass. So you see the firearm background check, victim notification. And this is kind of saying that when somebody who is being convicted for domestic violence crime tries to get a firearm, their victim should be notified. They may not be going after their victim, but let their victim know so that they can put measures in place to keep themselves safe. That didn't pass, but a lot of things passed. You can get more information if you're interested in any of these bills at the link there or just go to their website, Maryland Legislative Agenda for Women. And this is another organization I sit on, the Maryland Public Health Association. Again, you get some of your bills passed and some of your bills will not pass. It's you come back. It's not 1 year. Sometimes your bill will pass in the first year you introduce it. Sometimes you have to bring it to, a couple more times before it passes. You continue to build support. Either you don't have the right stakeholders at the table, or you didn't do enough networking, or there's a lot more you need to do. So for the Maryland Public Health Association, one of the bills that they advocated for, cigarette tobacco, that passed, but the opioid and overdose reversal drug information did not pass. It was referred to committee. And sometimes your bill is referred to committee, never comes out, nobody gets to debate it, nobody gets to vote on it, and nobody gets to pass it. In California, their legislative session is still going on. They've had some bills passed and they're still debating some bills, and that's what goes on. So these are some of the bills that have passed in California. You use local registration fees. When I worked at the National Center for Healthy Housing, one of the alternative financing mechanisms for home-based asthma services was introducing a fee to people who wanted to get their license for selling houses, and that fee was being used to fund home-based asthma care training. I mean, so a lot of times you create a policy, or you have to create, you need money to do something, and then government says, where can we get money? Okay, so public health, for instance, and the CPH right now may just be that all the money goes to the National Board of Public Health Educators, but it may be that they will introduce say $5 out of the monies that we paid to get our license will go to educating something or the other. There's that legislation, if it's going to be useful, will come out sometime in the future. So right now, I want to find out from people in the house. I'm going to share the Mentimeter again and see what sort of political activity have you done, if any, in this legislative session. What sort of political activity are you familiar with? So if I get that up, I will share my screen.
What was the code again?
I have to check and make sure that
Okay.
it is set. One second while this loads. So it's 58752095. Have you written letters to your elected officials? Have you written testimonies? Have you given oral presentations? Have you done education and advocacy out in the community? Should I give it a few? Quite a number of people have done education and advocacy. Usually, if you've done oral testimony, you may have done written testimony as well. And I guess a lot of people work for government. You may not be prone to writing letter to your elected officials, but these are all very important for us as public health practitioners, because the policies in our communities will not change unless we get involved. So unless we're writing these letters, unless we're testifying, providing data, will not change. And I guess that's another opportunity for us to provide data. So, okay, let's go back to our presentation, which is very nearly almost done at this time. So we've done that. And now, yay, it's time for practice questions. Before we take practice questions, are there any questions, general questions that I can answer? I see a question in Q&A.
Yeah, it says, are these details US specific in the exam?
I'm not sure I understand the questions, but if you're asking that in the CPH exam, if you will come, questions will be US specific. Absolutely. The questions in the exams will be USA specific.
I think I would say to everyone, similarly to the law and ethics section, you know, going through the reviews, I think are the best way to know what to kind of expect for these sections. We do have a question in the chat that says, what's the main difference between advocacy and activism?
I think it's really depending on who you're talking about. Advocates can be considered to be activist. It's like that picture that I showed at the beginning, for instance. I was being an advocate, but somebody can say because of the way I was wearing my face, because I was carrying a placard, because I had a pin, that's being an activist because you're saying you're being kind of like pay attention. So, but not all advocacy has to really be that pay attention. You can write a letter, you don't have to carry a placard. So when you write a letter to elected officials, for instance, when you email them, that's advocacy. They don't see you one-on-one, face-to-face. When you're saying you're being an activist, you're out, you're in the street, you are like, you cannot not miss you can't miss this information because I want you to get this information. So activism is more in your face advocacy, whereas advocacy is something where if you send the letter and you write it, if they get it, they get it. If they don't get it, they don't get it. But activism is advocacy that you don't want anybody to miss. That's my own, definition.
Yeah, someone wrote in the chat too, activism is a form of advocacy.
Yes.
Yeah.
It is. It's just it's advocacy. I do not want you to miss. I'm not going to leave it to chance that um you're going to get it or not. Great. Any other questions before we do our practice questions?
Doesn't look like we have any more right now.
Awesome. So let's go to practice questions, and I guess this is where I stop sharing and right.
So if you can share and just have the slides up so that people can see the questions. However, I will show the polls so that what they can respond through the polls.
Okay, so if I okay go back, just make sure.
And if you do you have the slides? If not, I can find them.
No idea.
All
So
right.
this is the first question.
And let me launch the poll for everyone. Okay. So I'll give you 45 seconds like I have in all the last ones, unless we have some really long ones. Okay. So the majority of people, 87%, said B, problem definition.
And that is absolutely correct. So if you want to work with say you have a problem, you want to work in school, for instance, and there's, nutritional issues in school. You have to identify the problem first. And then because you've identified that problem, it says to you that, okay, you want to consult with teachers, you want to consult with nutritionists. You have to define the problem. It makes you know who you need to have at the table and how you're going to analyze the problem before you can develop options and proposals for that issue. Next question. Yes, and that's the correct answer is D, include diverse constituents in the decision-making group. If you say, I see 5 people have collecting health-related data, the point is who collected the data. You don't know, for instance, that that survey may have been in a particular population that excluded some other population. So you really have to have everybody at the table and they can tell you that we were all surveyed or we were not surveyed, some people else were surveyed, and that becomes the basis of your next step. So having diverse constituents is really um, key to go. Yes, it's a complex problem. Again, if you look at the gun violence issue that I said, so it's gun violence. It's not just straightforward gun violence. Yes, people are dying from, but is it community-based gun violence? Is it a lone shooter gun violence? What is the population? So you have to have all of these conversations before. So it's really complex involved. It's complex. You not just the data, but you have to clarify your objective and what you want to do. Okay, that's I see 7 people looked at provide grant funding that supports state public health program, and that is true. But the real importance of CHIP is really the fact that it covers preventive services for children who otherwise might not have access to them. Without CHIP funding, a lot more children will fall through the cracks. So that's the real importance of CHIP funding. Absolutely. So all the other answers were trick answers. Really, public health policy programs and resources, we want to make sure people have access to them and they have access to quality programs that are affordable for them. So that is really the answer. And these are some of the things that you can look for in the exams and make sure that you read and reread the question, because if you look at lobbying, advocacy, and MX, yes, there's a ring to it. Federal, state, and local, there's a ring to it. But this question is saying the focus of public health policies. And so you have to, look at the question against the options to make the right selection.
And just to go back to that one, the answer was C, correct?
Yes.
Okay. Okay, this looks like a little bit mixed.
Yeah, so this is not grassroots lobbying, because grassroots lobbying is when you go out to the community and you're talking directly to the people who have the ability to vote for your elected officials. So that's not them. It's not political fundraising, because this person is they hired a firm to advance the approval. So it's not about fundraising. They want this firm to advance the proposal. So it leaves us with PAC and the lobbyist. And then a political action committee is usually a collective of more than one person, more than one group. So when you're talking about hiring a firm, that knocks out that. So this is how you eliminate your options. For instance, if you're asking a question, you look at grassroots lobbying and say this is direct lobbying, so this is not it. You look at fundraising, this is not talking about fundraising. So it leaves you with two possible answers, which is the PAC and the lobbyist. Political Action Committee talks about, we know about committee talking about more than one person, so a collective, so that knocks out the collective option. And then this is a lobbyist. This is, I talked about the industries that are anti-public health. We talked earlier on, and they're the ones who have lobbyists. We talked about the pharmaceutical industry as one of them. So that's a lobbyist. So your answer is D. So that brings us to the end of our questions for now. Public health is the right group to bring stakeholders to the table. We want to share this, like to share this quote from a past president. She says it's the right group to bring stakeholders to the table, possibly impact the social determinants. We in public health are collaborators by nature. We are conveners. We understand the power of synergy. We are the right people to change the way we are as a society, and we are thought leaders. And that brings me to the end again. So good luck with your exams, and any other questions will take you now.
Yeah. So I'm just gonna put, since this is our last session, I'm gonna put my email in the chat if anything comes up because you have questions about any of the review sessions, or if you have any other questions just about the process or study materials, please feel free to reach out to me. And that will be, I'll be happy to answer any questions that come up. Is there any questions for our presenter today? Well, I am not seeing any. So I would like to say a special thank you to you, Dr. Egbe, for coming on today. And thank you to everyone who has been attending the review sessions. And I wish you a lot of luck in taking the exam.
Good luck, everybody. Wish you the best.